going on out there in all things Medicare, particularly Medicare Advantage and Part D prescription drug plans. And so we're going to talk about that today. Hospitals, clinics, doctors dropping Medicare Advantage plans. And it looks like Medicare Advantage plans are dropping you. So let's talk about that today. My name is Ed Weir. I'm a former manager of the Social Security Administration. I've helped millions of people out with all things Social Security, Medicare, Medicaid, retirement benefits, survivor benefits, spouse benefits. So if you need help, if you got any questions, let's make sure you're getting the correct amount. Let's make sure you're going to file right. Social Security is not too forgiving. If you make the wrong decision, that might affect you for the rest of your life. So I've done close to 800 videos, doing more every single week to help you get everything you're entitled to. And this is a live chat as well. If you're watching this later on a recording, make sure you subscribe so you can know where to find us in the future if you have any questions. If you have questions today, looks like I've already got a bunch of questions there. So let's go ahead and get right into today's topic. So we'll talk about today's topic for about 10, 15 minutes, probably 10 minutes. And then we'll get into all of your questions. All right, so let's see here. Actually, this is, you can tell this is a live broadcast, right? This is not edited, all those fancy editing places. Yeah, so we're all about content, experience, expertise here. All right, so yeah, hospitals throughout the country are dropping Medicare Advantage plans. Not only hospitals, but clinics and doctors. They're just tired of Medicare Advantage plans. So what is a Medicare Advantage plan? If you have original Medicare Part A and Part B, if you get it at 65 or you get it after being on disability for 2 years, then that's great. Part A, Part B. But there's a lot of gaps in there. There's 6 major gaps, 3 in Part A and 3 in Part B. The big one is Part B. There's a 20% coinsurance. So if you don't have something to cover that 20%, you're going to have to pay 20% of all doctor's bills. So that's why people either get a Medicare supplement plan, those are the plan N and G, or they get a Medicare Advantage plan. Majority of Americans have a Medicare Advantage plan. They're enticed with zero premium and all that stuff, but they have prior authorization. So if the doctor says you need X, Y, and Z, then they have to get permission from the insurance company to do X, Y, and Z. So you get second guessed by some insurance accountant. And it's supposed to be a doctor, but sometimes it's an artificial intelligence that denies you. Yeah, which big scandal on that one. Anyway, but there's also networks. And that's one of the big issues is those networks are dropping and being restricted. And you sign up for a particular Medicare Advantage plan one day thinking it covers your doctors and your clinic and your hospital, and then the next month or the next year, then they drop it. And those are being dropped throughout the country. Why? It is because Medicare Advantage has those prior authorizations, and doctors and hospitals are tired of having to go through all the paperwork. They're tired of the delays. They're tired of the denials, and they have to file an appeal. And come on, this person needs this procedure done, and they have to ask permission and go through all the paperwork. And if they don't do the paperwork perfectly, then they get denied, and there's the delay in treatment, and people are really being hurt out there. So some hospitals and clinics and doctors are saying enough is enough. They're just not taking Medicare Advantage plans anymore, or they're saying, okay, we're not going to take it from this particular company. We'll take it from this company. They're a little bit better, not great, but better than this other company. So they're dropping Medicare Advantage across the board or particular plans. So, and there's also being delayed in term of payments. Hospitals, doctors, they bill, they do the procedure, they bill Medicare Advantage plan, and delay in terms of payments. And then there's also reduced payments. Medicare Advantage, it's, they're looking to make billions of dollars. They do make billions of dollars. And so they do that by cutting costs and paying hospitals, clinics, and doctors a reduced rate. And there's actually a big company out there that I avoid talking about particular companies, try to stay neutral in this whole thing in this respect. But there's a company out there that is one of the biggest in the country that pays these doctors so little for what they do. And they came up with a solution is to start a doctor loan program. So the same company has a kind of a bank that they help struggling doctors pay the rent and pay their staff and pay the electricity. So they get loans and they get interests And then so it's a crazy situation. Something has to happen here. We have to come up with another system. But in the meantime, you really need to make sure that your plan for 2025 in your particular case is still the best plan, is still there. Because another thing that's happening is Medicare Advantage companies are coming around and dropping you. So the hospitals are dropping the Medicare Advantage plans. The Medicare Advantage plans are dropping hundreds of thousands, millions of people throughout the country. And why? They get their accountants and they say, okay, how much are we making in this big city? Oh, okay, in this big city, we're making a whole bunch of money. Great, CEO is going to be able to buy a new yacht this year. But what about out in the country and out in the desert and out in these rural areas? Are we making a bunch of money? Oh, no, we're just making a little bit of money, not a whole heck of a lot. Well, let's just go ahead and focus on the big cities. So there's some companies that are reported. You can Google it, and there's a couple of big companies, you know the names, that have decided to just basically cancel 10% of their clients and just said, you probably I've already seen a lot of people come into my live and call and say, hey, I just got a letter and they just canceled me. So there's a lot of people that are going to be surprised. So make sure you read the letter. If you have a Medicare Advantage, you're supposed to have received what's called the Annual Notice of Change, ANOC. If you haven't received it, you should receive it immediately, if not sooner. They should have already got it out to you that said, hey, next year your plan is going to be this. It's the same name, zero premium, same doctor, maybe, but under the hood, that's the big thing. Okay, this year we charge $100 a night for a hospital. Next year we're going to charge you $500. This year we charge you $0 to see a specialist. Next year we're going to charge you $50 to see a specialist. So they're going to be raising that throughout. And that's another thing that, if the companies decide not to completely drop you because in your particular area they're not making enough money, there is another option for them. And they say, okay, well, maybe we should drop this area. And they say, well, what if we just raise the prices on everything? We might be able to make more money from this area next year. Some places, oh yeah, we're definitely not going to make enough money, so we're just completely drop them. But other areas, they say, well, we'll just raise the prices because we know people don't check their plans. Yeah, and that's what they're banking on. Okay, we'll raise the we're not gonna surprise them by start charging them a premium, zero premium, and start charging $100 premium, because then people will immediately change plans. So they don't do that. That's obvious. That's they're not that dumb yet. So what they do is they'll say, hey, people don't check their plans. They don't open their mail. They won't look at all the details until it's too late, until they actually have to go to a doctor, they fall or get sick next year, whatever the case may be. And then by that time, it'll be too late and they're stuck. So in this particular area, we'll cancel. In this particular area, we'll just raise everything. We'll decrease the benefits, increase the prices, and people won't check their plans. So they're banking on you not to check your plans. And most people don't check their plans. And so they're right. The insurance companies are right. They know the numbers. But let's teach them what we do when we come up with that type of situation, and let's go ahead and start checking our plan. So if you have a Medicare Advantage plan, a Part D plan, make sure you reach out to your insurance agent, broker, preferably a broker. The difference is a traditional kind of what's called a captive agent works for one company. So if you sign up for XYZ Medicare insurance company with that agent, and that agent is a captive agent, that's basically the only one they can sell, then when you call them up, they're going to say, okay, yeah, that's it. That's the only company we got. There might be a different plan, because these companies have several different plans. So they probably have 2 or 3, 4 or 5 different plans in your particular area. And then there's a new plan coming out next year, but they want you to stay on the old plan. But a broker, if you don't have someone that will be able to help you out, I've put together, it's one of those old Marine Corps things. If you want anything done right, you just do it yourself. So I put together a team that can help you out. So call that number, the 888, press 1, and you'll get my Medicare team will be able to help you out, or click on the little QR code there, and we can put you in touch with someone that will be able to help you out. Completely free service. But a broker is contracted with several different Medicare insurance carriers, companies in your particular area. So they shop around for the best one in your particular area. Doesn't matter which one you sign up for, they all get the same, it's all free to you. They get a commission from the company, but it's the same commission. Medicare, the government Center for Medicare and Medicaid Services regulates how much the agents get. So if they sign you up for, company X, Y, or Z, they get the same commission from that particular company. So it's, there is no difference there. All right. So, so let's beat Medicare insurance companies at their own game and say, guess what? We are going to check. So definitely check. All right. So let's go ahead and get into some questions here. And it doesn't have to be about Medicare. You can ask me any questions about disability, survivor benefits, spouse benefits, whatever. And I will answer questions for about an hour, another 50 minutes. All right. Let's see. Lori, what's up, Lori? I've been on disability since 2012. SS Social Security. I turned 65 August 2025. My mother had Medicare, a Medicare company. Her plan covered almost, if not everything. Is that available for me? Yeah, it really depends. And as I say, these companies, these plans, so your mother might have had that company a year ago, 2 years ago, and it covered everything, but maybe she was also receiving Medicaid, and people that receive Medicaid and Medicare have different plans available to them. Her doctors, maybe she had different doctors and that was the best plan for her. And that plan last year is no longer, that the name of that plan is still XYZ Super Gold Awesome Medicare Insurance Advantage Plan. It still has the same plan named this year, but everything under the hood is completely different. So I would never do that. I would never say, hey, my next door neighbor has this plan, so I'm going to go ahead and get it. No, for a Medicare Advantage, for a Medicare supplement, a plan N or a G, those are the same throughout the country, basically. So a plan N is a plan N is a plan N. It's just different prices and future prices that you need to look at. But for Medicare Advantage, I wouldn't go with anybody's recommendation because they might not have the same doctors you have. They might not have the same issues. They might not need some of the extra benefits, dental, vision, and hearing. And those plans change every year. So I would just look for the best plan for 2025 for you or for you. Yeah. So we're talking August 2025. So definitely whatever is available at that time, that's the best plan. So that's how you look for a plan. The first thing is for a Medicare Advantage plan, the number one thing you do is if you need our help, help from my Medicare people, that's the first thing they will do. They ask you what doctors you want to continue seeing next year. And then they will look at all the plans that accept those doctors. And then within those plans, they will say, okay, what about your prescriptions? Then they will narrow it down to the plans that save you the most money for your prescription. So from 50 different plans in your area, they narrow it down to 20 for the doctors and narrow it down to another 10 for the prescriptions. And then from those 10, they look at everything else. So, hospital, how much is it going to cost you to stay a night in hospital? How much for MRIs? Do you need any extra benefits like dental or vision or anything like that? So it's just kind of narrow it down, and then they come up with the last 1, 2, or 3, and they say, well, here's the winners out of the 50 plans. Here are the top 1 or 2 or 3. And then they give you your options, and then you decide what you want to do. And if you're like, no, I don't want any of them, then you say goodbye. See you next year. Can my employer force onto Medicare? I don't know about physically force. Nobody can force you on Medicare, but they can tell you that they're not going to cover the other 20% because you're obligated to sign up for Medicare at 65. So they can't force you. But they will just say, okay, if you don't get on Medicare, then you have to pay all the gaps that Medicare would pay. So that's it's like, old Marine Corps thing. Nothing is mandatory, but the repercussions are push-ups, the brig, 10-mile run. I live in California and have a PPO, had $67,000 surgery, and I paid only $260. Awesome. Good deal. So make sure if that's the same plan for next year, you're like, oh yeah, of course it's the same plan. No, That plan ends December 31st. All Medicare Advantage plans end December 31st, every single year. And then again, you'll have the same card, maybe the same pretty card, the same company name, the same plan name, the same zero premium, but everything else underneath can and may change. So let's see. Part one, we got a two-parter here on porch swing. In regards to CalPERS retirement and my union classification, we negotiated to pay into Social Security the whole time I was employed. I paid FDIC. I think that's I think you mean FICA, Federal Insurance Contributions Act, for the whole amount versus the law enforcement. Yeah, CalPERS is kind of strange. California is strange across the board for all things, sometimes strange in a good sense. So this person is talking about the windfall elimination provision that people that do not pay into Social Security get their benefits recalculated. So this person does not. So good. So the part two is how does Social Security calculate my Social Security benefits versus like a deputy? Yeah, you don't get the basically what it is people that have that windfall elimination provision, they don't get the extra welfare benefits. I've done a bunch of videos on that, and but yours is just counted to look like everybody else because you do not have a non-covered pension. Linda, what are we to do if Medicare Advantage isn't taken by our doctors or hospitals? And what is the difference between an HMO or PPO, which is better? If your doctors and everything don't take your particular plan, ask them if they take another plan. Or you'll have to just find, different doctors. An HMO is a more restricted network, and those are doctors that have contracted essentially with the Medicare insurance company or the Affordable Care Act or whatever, any type of insurance. So it's a contracted network. PPO is a larger network. You can pretty much go to any doctor that takes Medicare, but because they're not contracted, you're going to pay extra. So in the big cities, an HMO is usually perfect because there's a lot of doctors there. If you live out in the country, rural areas, on the desert or something, then a PPO is probably your only bet because there's not many doctors available in that network. So you'll have to go outside the network, and it's going to cost more, unfortunately. So if your particular doctor or hospital say, we're not taking Medicare Advantage at all, then one of the good things about some people I hear are hoping they get canceled. If your Medicare Advantage company sends you a letter that says, we don't like you anymore, bye, we're canceling your plan, you now have a special enrollment period where you can sign up for a Medicare supplement parent plan, a guaranteed issue without any health underwriting. So there's a lot of people that have contacted me and says, please, I hope they cancel me. I'm 71 years old and I really want to get back to original Medicare and get a Medicare supplement plan, but I can't because of my health. So if they cancel me, I can get a Medicare supplement. Yep, you can. So a lot of people out there are hoping they get canceled. It's kind of the one thing that people, it's unusual if people want to get canceled, but in this case, yes. I have my husband here. He's asking, I signed up for Part A at 65, but I'm still working and have employer health insurance. My question is, does Part A pay, or will my employer insurance pay, or does both pay? Both pays. So one of the reasons people sign up for Part A at 65, even though they technically don't need it because they have health insurance from work and they don't have to sign up. There's no penalty if you have health insurance from work and your employer has 20 or more employees. Is that in your particular case, maybe your health insurance from your company charges $2,000, you're the $2,000 deductible for a hospital. So if you have Part A, you only have to pay $1,632. So save yourself almost $400 because you're going to have a lower deductible when you get into the hospital. So that's why some people. So yes, they both pay. Sometimes Medicare will pay first, and so it really depends on all that. It's scary. It's about money, not human life. Yeah. It's for-profit health insurance. Has the areas been listed on canceling? Yeah, there's all kinds of different areas out there. Big region-wise, the Florida, there's a bunch of Medicare Advantage plans that are dropping. Florida, Missouri, the Southeast there. But then they're doing little pockets throughout the country, 10%. So I'm sure they get their bean counters there, their accountants, and determine, okay, what parts of the country, Dallas, okay, we're okay. Paris, Texas, not so much. Canceled. Phoenix, we're good. Casa Grande, canceled. Stuff like that. I'm just kind of throwing out the cities there. Yeah. And if you didn't get the letter, a lot of people, because this time of the year is the mass mailings and harassing phone calls on Medicare, and that's another thing is that, which is a good thing. The government has come in and finally clamped down starting tomorrow, October 1st. These lead generation companies are not supposed to be contacting you. So how it's been up until today is if you click on a Facebook thing or, respond to something and that Medicare insurance agent calls you up and tries to sell you something, tries to switch your plan or whatever the case may be, and you say no, they just spent that money getting your information. They paid, $30, $40, $50 to get your information, to get your contact, through Google or, whatever, Facebook. And they're out $30 because you didn't buy anything. So what they do is they take that and they sell it to everybody in the country for $1 here, $1 there, and stuff like that. And everybody in the country now calls you, and that's why you're getting 20, 30, 40 calls a day. Starting tomorrow, they can't do that anymore. Now it's a one-on-one. I know there's a lawsuit out there that's happening. They're trying to end that. And now with the Supreme Courts, with, that new ruling with the Supreme Court where, CMS and Social Security can't make their own decisions, really. The local, judge in a particular place in some part of the country, it's going to be overriding those decisions. But as of right now, if you tell John Smith in Topeka, Kansas, Medicare insurance agent to call you, then he will call you. And that's it. Done. End of story. Nobody else is supposed to call you based on that. So that is a very, very good thing. So if you need help, I've got a particular team, and then you request help from us, and then we will have one person call you up, and that's it. We never sell your information. We never call you either. So yeah. And that's one of the big things. If you're looking to change your plan this year, you might have to be a tad bit patient. You have from October 15th, the new plans come out tomorrow, but you can't change your plan until October 15th, from October 15th to December 7th. So you've got, a couple of months. But everybody in the country is losing their plans or wanting to change their plans, it seems like. And yeah, so you might have to be a bit patient, and please be patient with us as well. We will get to you. My team will get to you and help you out. We're not going to call everybody on October 15th. There's just not enough, but we'll get to you. So don't worry about it. We'll get to you. My wife is on disability age 65. Does she have to wait until full retirement age to collect on my Social Security? Mine is more than twice of what hers benefits are. No, as long as you're receiving your benefits, you have to start your benefits. It sounds like you are currently married. So you have to start your benefits. And as soon as you start your benefits, then she can start a spouse benefits on your record. If your benefits are twice yours, which you said they are. So, yep, you have to file on yours. So as soon as you file on yours, then she can file on yours. Who can I talk to about making the best Medicare choice for me? Are there independent agents that work for the individual instead of insurance companies? Yeah, that's what everybody I work with are independent brokers, and they work for they don't work, they're contracted with multiple companies. They don't work for any of the insurance companies. They're contracted with several Medicare insurance companies. So you tell them what you want, and they go out into the market and find the best plan for you, and it's 100% free for you. So yeah, call that number 888-817-0446 and press number 2. I I haven't received an ANOC, so what should I do? Yeah, the annual notice of change. Yeah, so if you haven't received it, it might have got lost in the mail or they haven't sent it out yet. Yeah, you're supposed to have received it by now, or at least in the next few days. But yeah, no problem. Just, get with your insurance agent or broker. Get with your insurance broker. I prefer brokers. Sometimes they use that name interchangeably. So, but always ask them, are you, how many companies are you contracted with? And if they say, 5, 6, 7, 8, 9, 10, then it's a broker. All right. So yeah, if you don't receive it in a few days, just get with your people or call, and my people can look it up online and see exactly what you got, and then compare it with your new plan from that company for next year, and then compare your new plan for that company for next year with all the other plans out there available. I read monitoring an abdominal aneurysm is covered by Medicare, but no mention of coverage to monitor us. Yeah, I'm a doctor, but not that kind of a doctor. Go on to Medicare.gov, and they actually have a pretty cool app. And it you can download the app. Let me see if I can show it there. Medicare.gov. And it's an app, and it's what's covered. So you type in, is my item or service covered? You type it in there, and it tells you whether it's covered or not. It's pretty awesome app Medicare has come out with. I am blessed. I live in a large city that all 3 hospitals take my Advantage plan. That is headquartered in my area. Awesome. Good deal. Good deal. You would have to call insurance agents in your town and ask if they carry Medicare Advantage plans, then make an appointment to go talk with them. Yep. If you want to use a local person, again, Medicare broker, again, they use that name interchangeably, but if you want to use someone in your town, absolutely. I am okay. Yeah. All right. Let's see here. You suggested a RIB and a previous post. Is that an application online, or is it only in person? Yeah, a RIB is a retirement insurance benefits. That's just a retirement claim. So yeah, if you're going to file for retirement, you can do it online. They make it very, very easy to do it online. If you need to provide any documentation, usually you don't even need your birth certificate nowadays. They changed that rule a few years ago if everything is correct in your record. Yeah, you can do it online. You can call the 800 number to schedule a phone appointment, or some offices do in-office appointment, or you can just walk in and what we call Social Security FEI, front-end interviewing, where you just walk in. Some offices, my office, when I ran my office, if you stepped your foot in the door at 4 o'clock, we helped you that day. Some offices don't. Yeah, they should, but they don't. Yeah, bad customer service, if you ask me. But anyway, I have medical and still being charged for my medicine. I have medical and medical. You mean you have Medicare and Medicaid and still being charged for your medicine? So maybe your Medicaid is a lower level. The states determine kind of the levels of your Medicaid assistance based on your income and resources. So maybe your particular state puts you in a lower one. So if you're having problems paying for medicine, then I would reach out to your state and see if they can upgrade your Medicaid. Because if you have Medicaid, then you also have the extra help with your Medicare prescription drugs, which is a Social Security program that you apply for Social Security. It's one of the easiest applications in Social Security. I'm sure you already have that, but maybe triple check just to make sure. And that assistance is being improved every year. All right, let's see. Somebody asked me about a particular company, whether it's good. Again, it depends on the plan in your particular area. There is no good companies or bad companies necessarily out there. There are, but you could have a terrible company, but that particular company is terrible in every other area of the country. But in your particular area, for some reason, maybe the CEO of the company lives in your area, but your area has a really great plan with that particular company. So it's what the company is really is not that relevant. For Medicare supplement plans, then the company is important, because you're going to be staying with that company for, when people sign up for a Medicare plan N or a G or F, they stay with that plan for pretty much the rest of their life, unless they, want to save some money and shop around later, which is a good idea. When COBRA runs out, is there a grace period to sign up for ACA, or does it need to be consecutive? I think what is the grace period for ACA? But with Medicare, there's a grace period of 8 months. I don't think it's the same for ACA, but I never tell anybody to do the 8 months thing, because, the day you're uninsured is invariably Murphy's Law. That's the day you get injured or something. So once your COBRA stops, it's going to stop about a month or two. Reach out to your local person that helps with ACA and in your particular area, because they're also run by states, and the states can kind of make different decisions based on that. So it might be different in your particular area, and ask them. For some reason you don't want to pay, you don't want to get ACA for 2 or 3 or 4 months, then ask them if that's okay in your particular state. Megan, friend on SSI. I always like these people looking out for other people. Social Security made her collect regular Social Security, stating her ex-husband marriage now qualifies her, and she had no choice but to provide Social Security with proof of her marriage and divorce. Meanwhile, no money. That is correct, unfortunately. SSI is the welfare-based program that Social Security administers. Social Security, supplemental security income. It doesn't come from the Social Security Trust Fund. Social Security has been handling that program for 50 years this year, anniversary. And because it is a means-tested program, that is a welfare-based program, if you have any other money out there in the world that you can collect, you have to collect those benefits. So if she's receiving SSI money from general taxation, and she has money available based on an ex-spouse, she has to get that money from an ex-spouse. Yes. And and one of the unfortunate parts of that is they make you get it, if you're eligible for it at 60 or 62, survivors at 60, or spouse benefits, divorced spouse at 62, they make you get it immediately. And you're like, well, that means I'm going to be reduced for the rest of my life. Yes. That's an unfortunate part. And you're like, but I wanted to wait until my full retirement age so I could get a higher benefit, so I didn't have to go ahead and receive, welfare benefits the rest of my life. I'd be okay at 67. But if you make it taking at 62, then I'm going to need assistance for longer. Yes, that's an unfortunate part of that. But yeah, maybe we need to get with our politicians and get that changed. IRMAA, Social Security, SSA 44. I'm 64. I'll be 65 in February. Applied for Social Security Medicare last week. Unemployed since 2023. Earned $250 prior years. When do I submit the 44? The agent didn't ask for the form. Yeah, once you get the official decision. So I would wait till you get the official decision, because you can't appeal a decision that hasn't been made yet. So an SSA 44 is basically an appeal or providing a life-changing event to get your IRMAA Part B premium adjusted. So once you get that nice little letter that says we're going to charge you $400 for your Part B, then do the 44, and then whatever extra premium you paid for January, February, March, or whatever, they'll pay you that money back. So does one need to update or change their plan every year with Advantage? You don't need to change it. You don't need to update it if you're in the best plan. No, but you do need to I recommend you do need to review it every year, particularly this year. If if last year okay, whatever, didn't want to spare the hour per the year. So, okay, if you're that busy, all right. But this year, yes, definitely. Maybe next year they might stabilize a little bit, and but this year, absolutely. Doesn't qualify for Social Security on her own due to known work, disabled. Oh, okay, yeah. So that's the person that was required. Yes, you're required. Good to see you today. Hit that like button. Yes, please, everybody. That's how the information gets out to more people. Okay, yep. Penelope jumps in there and answers questions, and she's 100% right all the time. So thank you, Penelope. How to have dental implant for Medicare or Medicaid? Yeah, that's a big one going around. I know a couple of years ago that nobody pretty much covered implants, maybe one company in one area or something. Yeah, no. But last year, more companies started covering implants, and haven't seen the new plans for 2025 yet. So, yeah, that's a thing to look for. Medicare doesn't cover it because Medicare doesn't cover dental, vision, and hearing. And I know as American citizens, y'all are going to get that done. It took us decades to finally get prescription added to Part D, to Medicare Part D. So let's do Medicare Part E or F and add vision, dental, and hearing. So let's get it done. But for right now, original Medicare doesn't cover vision, dental, or hearing. For the most part, 99.9%. If you have some terrible accident and they also need to, adjust your, jaw and do something dental, then that's yes. But typical dental as we know it, no. But Medicaid, probably not as well. If you have a Medicare Advantage plan, some of those are starting to cover implants this year. But again, 2025 is all bets are off for 2025. So just check your plans in your area. And when you talk to your people, your Medicare insurance broker, just say, hey, my number one concern for next year is implants, because that's what some people do. Again, that's what I recommend you do, because remember, all this money that the Medicare Advantage companies are giving you, these extra awesome benefits for free, it's not free. You've paid for every single one. All those years, all those decades you paid into FICA, the Social Security tax and the Medicare tax under FICA, the company is given that money by the government once you sign up for that company. So the company has your money, and it's your job to get it back. Just get as much back as you possibly can. So it's your money. Let's see. Keep in mind, you have to pay $1 monthly premium for a Medicare supplement. That is a fact. Medicare supplements. But sometimes, if you end up being sick or getting injured or something, that monthly premium just might be over the long term cheaper. And then it might be, better for your health because you don't have to go through the delays and all the rest of it. With a Medicare supplement, the doctor says you need X, Y, and Z. And if Medicare covers X, Y, and Z, that's it. You're done. Medicare supplement insurance company can't say anything. But you're like, but the company for Medicare Advantage is the same company that have Medicare Advantage plans. Yes, the XYZ Medicare health insurance company, they have Medicare Advantage plans and they can deny you and delay you services. The other wing of that same company, Medicare Supplement, they can't say anything on Medicare supplements. So basically, doctor says, you need this. Sends the bill to Medicare. Medicare pays their 80%. The computer system, Medicare computer systems, talks to the health insurance company, the Medicare supplement company, and the Medicare supplement company kicks out the other 20%. They can't say anything. If Medicare paid for it, then the health insurance company cannot say anything. So I'm in New York State and I want to switch from an Advantage plan to a supplement plan. You're lucky. In New York, they do things right. You can switch in New York. There's a lot more latitude in New York. But because of that, New York prices for Medicare supplements are the most expensive in the country because they do things right there. So unfortunately, a lot of people that have like a Medicare Advantage plan in other parts of the country, and they get sick and they're getting denied left and right by their Medicare Advantage company. And they're like, oh, I should have got a Medicare supplement, but I can't now. I'm sick. What can I do? They move to New York and they can't be denied. So yeah, it's so if every state did it like New York, then the prices would come down. So let's get to it and get that changed. The Craig had Medicare Advantage plans for years, frustrated with pre-authorizations and certain providers out of network, with plans ending, going to look into original Medicare guide for selecting prescription plan. Yeah, so a lot of people are trying to switch back too. Some people can, some people can't. Again, if you're canceled, then you can. Or if you move, or there's different, special enrollment periods for Medicare supplement. For prescription drug plan, those are really changing for 2025. But the prescription drug plan is, you look for Number one, the plan that covers your drugs. So each plan has a different formulary of drugs that they cover. And, then you look for how much those drugs cost, and then you look for the premium. So be careful. Some of those plans, particularly this year, next year, maybe a lot fewer, they have like a zero premium for the drug plan, or, $5 or $10. You're like, oh, okay, that's great. But then your drug, there's a big deductible, and your drug is a tier 2 or a tier 3, which is more. So you're like getting the zero premium. You think you're saving money, but you're paying more for the drugs. But this other plan over here, there's a $50 premium, but it's a lot less money for the drugs. So you have to compare those two. Yeah. Where do we find the areas? Yeah, I don't think there's a database that shows all the areas. You just you don't concentrate on every other area in the country. Just concentrate on yours. See what's available in your area. Why are they dropping people? Doesn't the government pay their bills? They just don't make enough. So they want to make more money as possible, the most money. Did the court reverse the stay they had on all those calls? Not yet. So you're talking about the CMS came down with that regulation. So hopefully that reduces your calls. And there is a bunch of these health insurance companies, agencies sued in a place in Texas, because that's what they do. They look throughout the country and see which judge is going to agree with them. And then they go, that's where they file the lawsuit. It's always Texas. Anyway. So they found a judge to rule on a couple of other things, but that particular judge said, oh yeah, we're not going to rule on, this lead generation thing. He kind of punted on that one. But yeah, so they haven't reversed yet. They haven't put a stay or anything on that, an injunction or anything on that yet. But it's interesting. The FCC, FCC's regulation for everything else. So like for life insurance and car insurance and solar panels and all those other crazy calls we get all the time, that is regulated effective February of 2025. But CMS moved that date up to tomorrow. And they said, yeah, the FCC and the FTC and CMS and got all together and said, here's what we should do, because people are tired of all the harassing phone calls. So let's go ahead and make it until February, starting February. And CMS said, hey, our big season is October 1st. So we want to move it up to October 1st. But all those insurance companies are suing now and trying to find sympathetic judges. But as of right now, it's good. It's very good. I think it's very, very good. But it's going to make it very difficult, to get help because of different, all kinds of different things. So to help you with your plan. So, all right, let's see here. A woman on another site remarked that she lived in a city in California that had no doctors who accepted Medicare, and she also has Medigap. Both were useless to her. Should she choose an MA plan? No, if they don't take Medicare, then they don't take a Medicare Advantage plan. So they have to take Medicare. So, had no doctors that accepted Medicare. Wow, yeah, they must be really out in North California or something. But yeah, a Medicare Advantage plan won't help because they have to take Medicare to begin with. The hospital near me will not take, and they are a nonprofit. Yeah, in Missouri, I know that particular company. I'm not going to mention them. You just read on the screen. But yeah, that particular company dropped Missouri. Yeah, so we're getting tons of calls from Missouri. Didn't you say that if you're on disability, you can call Social Security disability? You can change your plan anytime throughout the year. No, if you're on, probably what I meant was if you're on SSI disability, you're also probably on Medicaid. So when you're on Medicaid from the state, so you're on Medicaid and Medicare, you're probably on a dual eligible plan, Medicare Advantage dual eligible plan. And if you're on a dual eligible plan, yes, then you can change your plan several times a year, 4 times a year. I think they're trying to increase it, but 4 times a year. And then if you're receiving extra help with prescription drugs from Social Security, it's also called low income subsidy, LIS. If you're receiving that, then you can change your plan several times a year as well. And if you move and all that kind of stuff. So if you're receiving one of those two, so right now you can change your plan starting October 15th, and then the new plan will take effect January 1st. And then there's another open enrollment period from January, February, March. So if for some reason, you change your plan or you forget to change your plan, this by December 7th, then you've got kind of a little bit of a mulligan there where you can do it January, February, March. Yeah, but if you change it in January, it won't take effect until the following month, and you might be charged, something happens, you get sick or fall or something like that, you'll be charged crazy amount of money. So, all right. Would spousal benefits have to replace SSDI? No, they do not replace SSDI. They just go on top of it. That's a common misunderstanding that a lot of people are losing money because they're receiving SSDI, Social Security Disability Insurance. And because they're receiving SSDI, they've been on SSDI for 2 years, so they got Medicare. So they're paranoid. They don't want to lose their Medicare. So they don't want to get spousal benefits or divorce spouse benefits or surviving spouse benefits because they think that's going to replace their SSDI and therefore they're going to lose Medicare. No, that is 100% incorrect. You continue to get your disability. You continue to get your Medicare. It just, those benefits are added on top of your disability. So you essentially receive two checks, your disability check and your spouse, divorce spouse, surviving spouse benefits. So if you're able to receive $1,000 from a spouse and you're receiving $500, usually what happens is you continue to receive your $500 plus another $500 on top of it. You don't receive $500 plus $1,000. So one offsets the other, but it doesn't replace it. So you continue to get your Medicare. So spouse is on. So let's share that information because there's a lot of people out there on disability that have a lot of money waiting for them, sitting there waiting for them, but they're not doing it. So because they don't know, they're paranoid to losing their Medicare. So please share, subscribe, like, and all that kind of good stuff. So anyway, spouses on Social Security. I hate saying that all the time, but people need help. So spouses on Social Security. Do I apply for Social Security and spouse money and my money at the same time, or does it matter? You apply for it at the same time. Yeah. They changed that law in 2016. So now you have to file for benefits on your own record, and then you file for benefits on your spouse record. But your current spouse has to be receiving benefits. All right, let's see. All right, people answering other people's questions. I like it. Good deal. I like a good community out there. I asked my local Social Security office if I could get my ex-spouse full 50% after my SSDI converts to Social Security. They said no. Is that correct? Your ex-spouse full benefits after my SSDI converts to Social Security. Yeah, I'm not sure why. Because you're entitled to, if your ex-spouse is 62 years old, at least 62 years old, you can file for benefits on that record. And if you are able to wait until your full retirement age, you receive up to 50%. Probably what happened is you called the number, or you walked into the office and you talked to somebody at the front windows. And the people at the front windows are, as I always say, the hardest working, the least paid people in Social Security, but they're also generalists. They are not retirement specialists. They're not disability specialists. They're not supplemental security income specialists. They're generalists. They know a little bit about everything. And with the staffing of Social Security, a 50-year low, yeah, it's tough. So they just gave you the wrong information. So you probably need to schedule an appointment, call the 800 number, schedule an appointment for spouse benefits. And when you schedule an appointment, your appointment is scheduled with an actual, what's called a T2CS, Title II of the Social Security Act, a claim specialist. That's what I was before I became district manager. So, and they will be able to help you out and give you the numbers. And it might be a good idea to go ahead and start benefits now. Sure, it's early, but you get all those checks between now and then, and that just might help you out. My son is on SSDI. I'm his payee. I'm 70. He's 35. We have no family or friends that can take over as his payee when I die. What happens in a situation like that? Yeah, we ran into that problem in our office. I ran the third business Social Security office in the country, and we had the local county that used to be the representative payee for a lot of people exactly in that situation. And they ran out of funding and they stopped doing it. So we had thousands of people were, without a payee, and those people really needed a payee to handle their benefits. But there are kind of fee-based representative payee organizations. And I got to tell you right now, some of them, those get investigated all the time. And there's some fraud going out there. So be very, very careful. Start looking for a fee base. So basically, they will charge your son a monthly fee for taking care of his benefits for him, making sure his rent is paid and electricity is paid and stuff like that. So find that type of organization that helps out. Check out the Google reviews and call people and say, hey, which one is the best one that's not going to rip off my son, and then make arrangements, or switch it over to them now. And that way you can kind of check to see if it's a good decision, and try it for 3 or 4 or 5 months, and then if it's good, then continue on. So let's see here. So some company won't take Plan G. I am unhappy with this. Yeah. Well, wait a second. Some company won't take Plan G. No, no. Yeah. If a particular company begins with a K, try not to mention names. But no, that means they don't take Medicare. If they don't take Plan G, that means they don't take Medicare at all. So, and that company I know takes Medicare. Yeah, they're the ones that started HMOs. They started basically that health insurance. They're the interesting history. Those are the ones that built all the big destroyers and battleships for World War II, and they had the big shipyards, and so they provided health insurance for their employees, and that's kind of what started, that. And there's another plan, HMOs in Wisconsin, that kind of, those were the companies that really started, the whole system that we kind of have today. I don't blame them for how it's turned out, but no, they take Medicare, and if they take Medicare, they take Plan G. So something might not be, they might not take it for, if Medicare does it, it's like if I were a company and I said, hey, I've got Medicare, I want hair, they're going to deny me. They're not going to take it because Medicare doesn't cover that. So I wish they would. Please, come on, hook me up, people. Do I have to be 65 to receive spousal benefits off my husband's Social Security? No. And do I have to give up my SSI to receive it? SSI, if you're on welfare, SSI, then yes, you will have to give up. Well, it really depends on how much you receive from your husband. So if you said SSI, so I'm going to answer it as SSI. So if you're receiving SSI, the most you can get from SSI is $943 welfare. So if you get $500 of benefits from your husband, you can get that now. If you're on SSI, they should have already made you sign up for it. When you're on welfare, they make you sign up for anything that's available out there. So if you get $500 from your husband's account, they will just reduce your SSI by $500. Oh, okay. All right. So they mean SSDI. No, same type of situation as I talked about the previous question. You'll get spouse benefits on top of your SSDI. So it won't replace it like SSI. Well, in some respects it will, but no, it won't stop it. You'll just get extra benefits on top of your SSDI, and your SSDI will still continue, and your Medicare will still continue. All right, let's see here. Kevin, we've been playing phone tag forever. I called you up a few times yesterday too, but we'll try again today. All right, so Kevin, let's see. Let's see here. Kevin, I was sorry that I was supposed to be a RibDib prescription. RibDib prescription. So yeah, I'll try to call you up again today, Kevin. Kevin had a private appointment, and if you want, I do charge for these. Unfortunately, pay for everything else. So if you want, you can click on that little QR code. That little QR code right there, and there's a little place where you can schedule a private appointment with me. I only do a few of those a day to pay for everything else. But yeah, what a rib dib? What is a rib dib? RIB is retirement insurance benefits and DIB is disability insurance benefits. So you can file for both. So if you're disabled, you're unable to work because of a disability, and you go ahead and file, it takes 6 to 9 months at least to get a initial decision. And a lot of people can't wait 6 or 9 months for no money coming in. So what they can do if they're 62 years old, they can go ahead and file for retirement benefits on their own record, start getting that money, getting that check every month while they're waiting for the disability benefits to be approved. And once they are approved, then their disability is reduced by those few months. Usually it's not a big deal. Or you can actually pay that retirement benefits back and then, not be reduced. All right. My mom is 83. She only gets $680 or so of Social Security. She has a company. They seem to all have only had a couple of changes. Do you know if that is? Yeah, there's tens of thousands of plans out there. So not sure about that particular plan. And nobody knows until tomorrow. So I can't even look it up today. I can, but I can't tell you. Or I'd have to, anyway. I just turned 60 August. And was told to call Social Security to go from SS disability to retirement. Plus, I am divorced widow. His monthly amount is lower than mine. What should I do? Yeah, so you're 60, so you're eligible for survivor benefits if you were married to anybody that passed away, or you were divorced from that person, married to that person for 10 years. But that benefit amount has to be more. So if you're on regular Social Security disability benefits, you don't have to go to retirement benefits. I wouldn't, because you're going to be cutting your benefits. But survivor benefits, you can add those on top of your disability benefits. But if his monthly amount is lower than yours, then no, they're going to deny your claim because there's no money there. But I'm not sure how you found out his benefit is lower unless you asked him. But if you just guessing that it's lower, I would call up if you haven't already. If you haven't got the official number and 100% for certain that his benefit amount is lower, then you don't have to do anything. All right. I am currently collecting Social Security under my husband's insurance. However, with changes to Part D in 2025, his insurance might not meet Social Security requirement. What should I do? Yeah, the Medicare requirement. Medicare. This is going to be a crazy season the next 3 months. I might sleep 3 hours over the next 3 months. But anyway, Medicare has made a bunch of changes to the prescription drugs. One of them next year is the max that they can, charge you out of pocket is $2,000. And you're like, that Inflation Reduction Act, it's causing so much problem. That wouldn't be a problem in any other country in the world, because pharmaceutical companies, in our country charge 5, 6, 7, 10 times what they charge in other countries for drugs that the NIH, National Institute of Health, funded. So the whole system is crazy. We paid millions and millions of dollars for this research, and then we give the research to these drug companies. These drug companies make a drug. They charge us 10 times what they charge countries in Europe and Japan and stuff like that, because those countries negotiate with those companies, but we don't. And we just started. Anyway, don't get me started. So anyway, super long story short, they punted on that one. Basically, for that particular thing, reach out to your husband's HR and confirm that. About a month or 2 months ago, that was the fact. But Medicare heard about all the complaints about, oh my gosh, and so I would reach out to your HR and say, okay, is that still the fact? Is this not considered credible? And there's a very, very good chance. And it says, oh yeah, no, we're good. Medicare has, delayed that until next year. So reach out to your health insurance company and confirm that. You're probably good. I turned 65 in February, still working. How do I get started on filing? Yeah, if in terms of 65, if you're still working and you have health insurance from work and your employer has 20 or more employees and you're happy with it, you don't have to do anything. You're not mandated to sign up for Medicare Part A, Part B, or money or anything like that at 65. You can wait until you stop working, stop receiving health insurance from work. But if you want to go ahead and sign up, 2 or 3 months before you turn 65, you can file online, call the 800 number, schedule an appointment, a phone appointment, in-office appointment, and get it started then. But between now and then, you need to start figuring out what you're going to do to cover all the gaps, whether you want a Medicare supplement plan, a Medicare Advantage plan, or whatever the case may be. And I've got a bunch of videos that can kind of compare the two, or you can, probably very soon you can contact our people, probably October, November, once the craziness dies down. Well, I think the craziness is going to be all the way to December 7th. It's going to be unbelievable this year. Call us up in November, December, before this. With you can call it November, December. Probably call it late December. And maybe December 10th, once people sleep for 48 hours after the season. It's going to be crazy. All right. We are over an hour there. And if I missed your questions, unfortunately, we had a lot of questions there. I apologize. We're out of time. Oh, let's see here. I think, what did I see here? Roxanne became a silver member. Thank you, Roxanne, for the support. I really do appreciate it. You are too awesome. Let's see here. So, yes, if I missed your question, I apologize. I will be back again tomorrow. I'm going to try to do a video, a live Q&A every single day up until December 7th at least. Try to walk you through all this nightmare that's happening. And I don't know if you know, there's a presidential election going on. And with the new president and the crisis coming with Social Security, there's going to be a lot of changes with Social Security and everything, new plans, So I'm going to keep you up to date on all that. And we're going to make sure that, politicians do us right.